to teach us more about the healthcare market in more detail. And you will share your own slides, right?
Okay. Yeah, thank you, Anna. And first of all, I want to thank SweetCare for this invitation. It's great to see so many people have interest in Taiwan for the healthcare market. I would also like to thank Ambassador Guo, although he left, he gave a very good overview about the Taiwan healthcare overall situation. So I will go a bit deep dive for more details. Yeah, so I have about 20 minutes. Key objective is to provide you the overview to understand the Taiwan healthcare system and also what is the healthcare demand, and also give a bit of digitalization aspect of the healthcare system, and then the summary. Yeah, so I think as Ambassador Gu just mentioned, Taiwan provides universal national health insurance to Taiwanese people. So almost 100% of the population of the 23 population is covered by an NHI program, and over 93% of the healthcare institutions are contracted with an NHI system, both for public and also for private one. And so it's a good benefit for the patient. We can access to all the medical resource very easily, but also very good for the supplier as well, because once you are approved for the NHI reimbursement program, you can access over 90% of the market here in Taiwan. And the satisfaction rate for the NHI system is very high. Over 90% of people are satisfied with the system, and many because of the accessibility and also the quality of the service. And I just give you one indication that maybe can show you the quality of the healthcare in Taiwan. It is that we in Taiwan is although it's a small population of 23 million, we have over 26 medical charge particle radiation therapy that is mainly used for cancer treatment, and according to some sources, is actually Taiwan is ranked quite high in terms of such system per capita. But in other hand, we actually also offer a cheaper price for such kind of treatments. So this also attract international patients to come to Taiwan for such treatment. So I summarize in 3 words for the key characteristic of a healthcare system here in Taiwan is accessible, affordable, and also with good quality. Yeah, but this is a bit too good to be true. How can you be cheap and also deliver good quality? So definitely there's some challenges for this NHI system. And the main challenge is that the overall system is actually underfunded. So it causes some challenges in the system. And I would like to compare the 2 systems in Sweden and also in Taiwan. So both Sweden and Taiwan deliver very good quality of healthcare, but the fundamental structure is different. In Sweden, the healthcare is decentralized and delivered by the municipality and the regional government, while in Taiwan it is delivered or government by the central government, and it is a single payer system by the government. And healthcare expenditure in Sweden is about 11%, and in Taiwan it's 6.6%. And Taiwan is actually quite a bit low compared with the most developed country when it comes to percentage of GDP for healthcare. And for funding in Sweden is a tax-based system, but in Taiwan it is a premium-based system and based on the salary. Yeah, so it's a split between the insured 20%, employer 70%, and also the government by 10%. In both systems, dental care is included. In Sweden, it is up to age of 23, and in Taiwan, the basic dental care are included by the insurance program. Number of hospitals in Sweden is about 100 hospitals, and clinics about 1,000, and all are contracted under the insurance program, as we understand. And in Taiwan, we have about 480 hospitals, over 99% are contracted with NHI, and the clinics is close to 23,000, and 93 are contracted with NHI. And when it comes to public and private hospitals, the ratio is actually reversed. In Sweden, 85% institution is public, while 15% is private. But that big figure is a reverse in Taiwan. In Taiwan, a majority of the health institution is actually private, close to 85%, and the public is about 15%. Okay, yeah, because I'm doing the presentation more, so I cannot see if anyone raised your hand if you have any question. But if you can, you can write your question in the chat, so I can maybe adjust them at the end of the presentation.
And we will also have a Q&A at the end. So
okay,
yeah, maybe better.
Yeah, that'll be great. Thank you. And so for I just mentioned about the funding of the NHI system. It is adopted the global budget payment model. So it means every year the government will decide a total budget for the NHI, and it is actually a limitation of the growth rate, which is 5%. So average the growth rate of the budget is about 4%. And then all the services or the medicine and all the medical device, the labor within a year is to be divided by the global budget. Yeah, so this is how the government control the total budget of the system. Yeah, so it results that if we compare Taiwan with other developed country, for the percentage of the GDP that is used for healthcare, Taiwan is actually quite low, and you can see that the average 6.6%, and yeah, so Taiwan is quite stable on that figure, while the other countries are keep increasing for the percentage. And so compared to South Korea's 8.8% and Sweden about 11%, so Taiwan is usually quite low in terms of the GDP on healthcare. And so it created challenges that for the new innovative healthcare solutions for medicine, it will be very quite difficult or lengthy process to be approved by the NHI program. So I think that's also the common challenges when we discuss with the Swedish companies, and they say, well, this process was going to be very lengthy, and also maybe the reimbursement price is not to the level they expect. Yeah, so we this is kind of the common challenges for the foreign supplier to Taiwan healthcare market. And also the Taiwan government conduct this yearly price volume review for the medicine and also medical device, and that will also keep the reimbursement price lower. Yeah, so this is a trend that more and more the new drug and new medical device solutions, they will be enter to Taiwan as a self-payment solutions. Yeah. And so the medical institution in Taiwan is divided to 4 layers. Start with medical center, regional hospital, district hospital, and clinics. And medical center is the highest one. It has the highest standard to be accredited as a medical center. And we have 24 medical centers in Taiwan. And the clinic is have the biggest volume, so that take care of like the primary care role in the healthcare system. And we also put the registration fees here as a to show an example. This is the working price to receive the treatment in those medical institutions. So the lowest one is USD $5, and for the medical system, $15. Yeah, so even it's a difference, but it's not expensive. So it actually results that patients in Taiwan can easily go to medical centers for some small disease treatment. So the referral system is actually not very strong here in Taiwan, and that will result in a lot of medical resource waste. Yeah, so this is something that government is working on, but to adjust the fee is also a kind of a political concern as well. Yeah, so this is something that we know is a big concern for the government, that the referral system, how to make it more efficient here in Taiwan in order to reduce the medical resource waste. And in terms of the personnel situation, the healthcare personnel situation, the quality of the healthcare personnel is quite high here in Taiwan, because in Taiwan, it's only the top students can be admitted to the medical schools, and the doctors are well trained in the school, and many of the doctors also receive their training overseas. And so, in general speaking, that the nurses and the doctors are quite well trained here in Taiwan. But I think in many countries, we also have this personnel shortage. If we compare Taiwan and Sweden, per capita, in Taiwan we are 44% lower in terms of number of doctors and nurses, and also doctors. Yeah. So, and even after COVID-19, more nurses are leaving their work, because there's a very long work hours and very stressful workplaces conditions for them. And also because of the cost containment model NHI implements, so it actually sometimes gives volume over quality in aspect when the personnel that deliver their services. Yeah, so that also cause that they need to work very long hours in order to take care more patients. Yeah, so this is also another challenges of the healthcare system, how to improve the working conditions of the medical personnel here in Taiwan. So the government have some initiative to work on that to improve the working conditions. And one of the aspects is also to use more digitalization solutions to help the medical personnel to improve their work efficiency, and also to reduce the medical waste in the system. Yeah, then this is more like the demand side. Taiwan is today we have about 70% of the population that is about 65 years old, and the percentage is expected to be grow to 20% in 2025, and that will make Taiwan as a super age society. Age society and super age society by 2025. At that time, we will reach 20%. And so the elderly population, the fast growing elderly population in Taiwan also will drive the cost for the healthcare very rapidly. So that's also another concern from the cost perspective. The top disease of death here in Taiwan, cancer is number one, about 28%, and followed by the heart disease, about 12%. And if we look at the top five cancers between males and females, we can see like colorectal cancer and the lung cancer are the top ones for the happening. And the chronic disease is another major challenges of health concerns in Taiwan, and especially for this renal and kidney disease, and also diabetes. So these two diseases combined, that is up about 12% of the total NHI expenditure. Yeah, and so the about 10% of the population are having diabetes in Taiwan, and that also may lead to kidney failure, and number of over 86,000 patients they are receiving the hemodialysis, and this also costs about 8% of the NHI cost. Yeah, so this is we know that the authorities also have on their mind to work on how they can reduce this situation, and maybe to increase the quality of care for diabetes for early prevention. Yeah, so they can have a better treatment, and just to prevent that they will result in the final stage that the patient will need to receive a dialysis. Yeah, and so the government has implemented some diabetes patients care program, and to increase the quality of care, for example. Yes, a little bit the digitalization aspect of the healthcare system, and as Ambassador Gu mentioned, in Taiwan, everyone we have a NHI smart card, and it's an IC card, and every time you receive some medical treatment or services, you use an NHI card. And started from 2017, and all there's some records are cloud-based and needs to be shared between different medical institutions. Yeah, so this is also a very effective way that to avoid double examination. So in the table, you can see this all different kinds of data that is in the system that can be shared between different hospitals. For example, like surgical records, and also X-ray examination records, etc., and medicine records, etc. And another digitalization result is this we call the My Health Bank. Is an app that everyone can download to your mobile phone, and you can check what is your records to receive a medical treatment, and also what is the major key parameter of your health. Yeah, and the government also opened up this app SDK with the third party. So now we know like more and more startups, they are working on this app to integrate the NHI data with their own app in order to develop more like value added personal healthcare solutions to the people here in Taiwan. And then because NHI has this centralized database that built since 1995, and so they have like billions of data there. So the authority also start to offer this de-identified data, and this is more for like AI application. So if the research institute or a company, they want to develop the solution for AI and they want to train their AI with the data, and they can apply with NHI to access to those data for AI development model. So this is also like the future key industry that the Taiwan government is developing for the healthcare. Yeah, just give you some examples. As you know, you might also know Taiwan is very strong in terms of the ICT industry and also like semiconductors, and so we have a very well-established value chain when it comes to ICT products. And several companies like Quanta, Asus, Acer, they used to work with laptop, but they also switch to the medical application now. So they leverage on their expertise for digitalization, the ICT, and work with the healthcare partners to develop the solution like AI, digitalization, cloud solutions, and they test their product here in Taiwan, and then they export to other countries. And here is to show the medical device import market. So the medical device demand, local demand is about 6.7 billion, and the import is about 3.5. So it's over like 60% of the medical device is import. But if we are looking at only the high-end part, for example, like imaging, the implant, and over 70% of the medical device is import. And for like orthopedic products like implants is over 55% is import. So according to the source, the growth rate is still very rapid, and it's about 7% of the yearly growth. And definitely the aging population is one key driver behind this. And we do also have a local medical device industry as well, but it's mainly more focused on like mid-end of product, for example, like contact lenses and glucose meters, thermometers, etc. Yeah, so for high-end medical device, we believe is still a very good market for the companies. And yeah, so in Taiwan, we also have our the medical device registration system, and the authority is the Taiwan Food and Drug Administration. So it's very similar to like a USA system. So it's also risk based. We have a class 1, 2, 3, and also new devices. And so we also provide you the reference, like the estimated time for registration. And for the class 1, it can be quite short time, like 2 months can be approved. But for like a class 2 with a moderate risk can up to like 10 months. And class 3 can be up to like 1 year or 1.5 years. So you will need to go through all those registration process to have your product to be able to sell in Taiwan. Okay, so in the end, I just want to summarize the strengths, weakness, opportunity, also threat for the Taiwan healthcare system. So it is one of the Asia most developed healthcare system, and we have a high quality of healthcare workforce, and it is a universal coverage, and we also have a very strong local ICT supply chain that can have the future medical application. And the weakness is that the product registration process can take some time, and also because the system is underfunded, so it will also pose some challenges for the new and innovative drug and solution to be approved by the NHI system. And also, the healthcare personnel is overloading, and this is also quite some medical waste in the system. And the opportunities that the government is working on the digitalization solution, try to improve to reduce the waste and also workload from the healthcare givers. So it gives us some opportunity for the digitalization companies to offer such solutions. And the Taiwan deliver very good quality of care. So these hospitals, institutions, they are have high demand on these very advanced products. I think we show you that this medical charge or particle treatment. Taiwan have a quite high number compared internationally. And also the opportunities is to access to those HI database for the AI development. So it could be partnership can be built between Sweden and Taiwan's research institutes in order to train your AI for Asian demographics, for example. And threat as the aging population keeps drives the cost of NHI. So this has been a very big debate in Taiwan. Is the NHI system is not that sustainable? How to make it the budget can work for long term, and also the price value survey can keep the reimbursement price low. And also, there's also some discussion. It could be like transparency issue from the hospital tender process. Yes, I think this is actually my last slide. So, okay, I hope I didn't take too much time. I just want to see if any questions, maybe.
Yeah, thank you so much, Koka. Really interesting, and I think you spot on the type of information that we are interested in. I found the database, the opening up of the NIH database quite interesting. But I know there are others that have questions, so please you can raise your hand or maybe just pitch in if there's no one else talking.
I have a small question, CK here. Regarding the NHI system in Taiwan you were talking about, I mean, if we want to sell or introduce the product into Taiwanese market, do you have any introduction or system how this kind of authorities works for certain applications, what need the process? Is there anything more we can know about it?
Yes, I think the first step you need to have your product registered with the TFDA, so get the medical device license first. Then the second step is to apply with NHIA, which is the authority in charge of NHI, and to get the reimbursement approved. Then that will take another few months. And there's also professional consulting services company can help you with both the registration and also the reimbursement process here in Taiwan.
Okay, thank you.
Okay, do you know if, because for example, in the US, it's really important to get the coding right for the reimbursement so that you fall into the right category, because that decides how much you can get paid and how much the hospital can get paid from the system. But is there, that way it's really important to consider your reimbursement strategy at the same time as you're applying for registration. Is it the same in Taiwan?
Yeah, the reimbursement is according to the code. Yeah, you are applying for. Yeah, so I think this really requires a kind of professional consultant to suggest. And sometimes maybe you don't follow the current existing code. Maybe you even apply for a new code for your product if you think it's actually adding much more value than the existing one. So yeah.
So do we have other questions? Can I ask if this about the database being, well, not open access, but you can apply to access it, and is that possible for anyone? I mean, for foreign companies, for example?
Yes, it's actually open up for the research institute here in Taiwan.
Okay.
So for a foreign company, we would suggest that you collaborate with a local research institute, can be like hospitals, and you have some kind of joint project, and they can do this kind of research and access to those database.
That sounds quite interesting.
One more thing. One of the slides you list down the whole top 10 or top 4 or 5 health issue in Taiwan. Are those statements that Taiwan is looking for help to products for these diseases, or it is just a general information for us? Or so it's like diabetes, all what country have this problem, and if we have something good for just diabetes, and that there will be high chances for us to launch this product in Taiwan, or is something do you understand my question?
I would say diabetics and the kidney diseases are more severe because it takes a lot of NHI budget for this type of disease. So definitely, this is a trend.
They're also like in China, when they are doing something, they announce, okay, now we are going towards all cancer treatment products. We are interested, so the possibility and or success rate will be higher if we introducing something towards Taiwan, China. Then, so this maybe if we have this kind of products for this Hall of Fame top 5, if we introduce something, that means also maybe is that higher chances for us to success to go through to NHI or something like that.
Yes, definitely. Cancer treatment is a type also top priority here, but we also see that more and more new cancer treatment are actually self-payment. For new treatment. So and as you see, even self-treatment, we still have quite a big number of those advanced equipment here in Taiwan. So I think it's actually an indication to show that is high market demand here.
Understand.
And is there
is there any days specific that government will tell, oh, now we have this huge public health problem and we want to do something, so all people that is in this area are welcome to talk to us, and they arrange a special team to work with us? That the reason I gave these questions is that the success rate, I think, will be high. That's the thing.
Like I cannot just pinpoint one thing or one event that government do this announcement, but you see like everywhere in there, like a report in articles and a different kind of conference. And this is how the topics. That is brought up by different key stakeholders.
Yes. Thank you. And maybe let other people ask.
Okay, Yuan, you have a question.
Yes, I do. First of all, Koka, thank you for a very good presentation. It was extremely interesting to hear the view. I have a question about what is the situation when it comes to running solutions for the healthcare in the cloud, like Azure and AWS and so on in Taiwan. Is that approved or is it issues around that?
Make a cloud on AW system, which system? Right.
Can you explain a little bit more, Johan?
So here in Sweden, for an example, since we had the Schrems II Act verdict, so to say, there are governments that are restricting the use of Azure and Amazon and Google cloud solutions. And if you have a software that for the healthcare market that is based on that, would that be an issue in Taiwan?
This not I'm not sure, but I know there's like some government guideline or regulation on this where the data can be stored, and I think one is like probably they don't allow this type of data to be stored somewhere outside of Taiwan. Yeah, I think that I think is the main principle. But I think that they have a more detailed like guidelines where this personal health information can be stored.
Okay.
But that's something maybe you can double check for you. Yeah.
Super, thank you.
And Lynn, you're next.
Yes, thank you very much, and thank you for a great presentation. I wanted to ask, what is the perception regarding cancer in Taiwan? Is this a disease, I guess, that's well known? And also, like, do people come early for treatment or do they come late for treatment? Do you know that?
For some key cancer, Taiwan have the screening program. For example, like breast disease and lung breast cancer and also lung cancer. I think there's several ones, key ones that we have the government have the screen program. So you are above to a certain age, you are you need to do this kind of test. Sorry, in order to have like an early detection for the cancer to find those patients. Yeah, so the general perspective, I think people start to learn, change their mind. This can be kind of some kind of chronic disease now. You will have to receive quite long-term treatment and need to cope with this. Yeah, I would say, yeah, that probably will be the difference for the mindset now. Yeah, compared to the earlier, if you think you have cancer, you probably will die in 5 years. But now I think people can cope with that. It's actually a more long-term disease. Yeah.
Okay, thank you very much.
Thank you, Koka. I don't see any other questions. So if there aren't any other ones, I will just say thank you so much for a great presentation, Koka. Okay, now we have Pontus.
Yeah, I have a question here from Mentis. So you have obviously, well, first of all, thank you for a great presentation. I noted that you have a shortage in personnel coming up. So you have challenges on that part. You also have an aging population. So does the government provide any kind of grants or budget specific to drive this transformation to address these two issues?
Yes. Yeah. So the shortage of personnel. Yes. The government offers some kind of different incentives, I think. Yeah, try to to solve the problem. Yeah, but for the details, I will need to check more in details for you. But the government is on those topics right now. Yes, but how efficient or how effective is to be evaluated. Yeah.
Sure. Thanks.
Okay, but thank you so much, Koka. As I said, really, really great presentation. And yeah, in case there are other questions, maybe you will be available to answer them one-on-one through email or so. Yeah, so with that, we'll take the step to the topic of the trip that is planned for October, and I will let the Yiwen make a presentation about the trip.
Yes. Hello, I'm Ewen Chen, and I'm actually from Taiwan, but since I finished my bachelor's here in Malmö, I've been working at Piku for about 3 years soon. And I will share with you my PowerPoint. I think
Yeah, Koka is maybe sharing her screen
Yeah.
still. Can you unshare? Great. Thank you.
I hope everyone can see the PowerPoint. So this trip, we're going to Taiwan on 14th of October, and we will be back in Sweden on 20th of October. This I just want to show you that after hearing from Ambassador Gu and Koka, you can imagine the healthcare system in Taiwan is very efficient. And for me, before moving to Sweden, I never experienced that I will have to wait for maybe like 1 month for my dental appointment or 2 weeks for a midwife appointment. It's very rare in Taiwan that you will have to wait. And not to mention that a lot of people in this country have to wait for 90 days for their treatments. And that's why I thought, okay, with my own experience, why not we do a healthcare study trip to Taiwan so that I can, not me personally, but our healthcare system can show that it is possible that people get more efficient treatments and get the care they need in time. And in this trip, we have a facilitator, Half Khalid. Half is very experienced and known in healthcare in Sweden, and he's very engaged also in international healthcare networks. So he will be perfect for this job. And we will have summaries every day after our activities. And Half will be moderating those summaries. And in Taiwan, we will visit, of course, the healthcare ministry. And there we will be hosted by Taiwan's Vice Minister of Health Department, Bishan Wang. There we will, of course, talk about the system itself and also the finance, the implementation, and also some common problems within healthcare that both Taiwan and Sweden share. For example, like mentioned earlier, a shortage of staff. So we will be able to talk about how both Taiwan and Sweden tackle these kind of problems. And we will visit a hospital in Taipei. It's called Taipei Medical University Hospital. And here you can see a brief summary of what you can expect during the visit. So it will be mostly about the implementation of the healthcare system in a hospital that you can see in practice. And of course, we will talk about, these listed topics. And if you have more questions or if you have something that you're more interested in, you're always welcome to inform us, and we can always do an adjustment in the program. And later we will have a link to our website where you can see the full program. And we will also be visiting Taoyuan City. So it's about 30 minutes drive from Taipei. And there we would like to show you how this healthcare system is implemented outside the capital. And Taoyuan is experiencing, of course, an increase in the elder generation. And also there is a lot of foreign workers in Taoyuan. So we will see how the government is working with an increasing number in both the elders and also foreign workers. And in Taoyuan, we will also be visiting a local healthcare clinic that's about 600 meters high up. It's called Hualing Medical Center. So what's so special about this medical center is that the population around that area are mostly elders. And because it's very high up, that makes it not so easy for the residents to access the healthcare facilities in the city. It would take them about 2 hours on a moped. And you can imagine if it's elders with a lot of health issues, that makes it very difficult for their health situation. So this healthcare facility called Hualing Medical Center, there they combine the use of AI and other digital devices to make it easier for the elders to get treated. And if they do have severe health conditions, then they will transfer them, of course, to hospitals that are in town, which are more capable of treating the severe diseases they have. But there, the most important thing is to talk about how can we make it possible for healthcare to be equally accessed even in rural areas, because that's also a major issue in Sweden. And it will be very interesting to be able to have a discussion over that. And here we want to show you what is included in the price. So it will be the study trip and the visits, and also the flights from Sweden to Taiwan back and forth. And of course, the hotel and breakfast, lunch, and dinners. And we will also have a person on the ground in Taiwan to document the visits. And yes, we will have a program report after the trip. So we will finalize and have a, how do you say? We will present to you the final documentation from this trip. And afterwards, we're aiming that we can have a reunion webinar, or we meet in person to follow up on how everyone can make use of the information they get from the study trip. And I want to say this again, that we are aware that we have target groups that are from private medical companies and also politicians. And we are open to have parallel programs that will fit everyone perfectly, so that your time in Taiwan wouldn't be in vain. And you can contact us at Piku for sure. Here are our contact details. Thank you, and I hope to see you in Taiwan.
Thank you so much, Yuan. I just have a question regarding the language, because we see that the
Yes.
slides are in Swedish, but what will the speaking language of the trip be?
So everyone that we'll meet in Taiwan will speak in English, of course. I don't think we will be happy to have to learn Mandarin beforehand. But the documentation will also be in English. And if we have participants that prefer English, then our facilitator Half would, of course, adjust to that.
Ingrid, would you like to add something? You're muted.
Do you hear me now?
Yes.
Only a few words to complement my colleague Ewen. I am CEO at Piku, and of course I also have been planning a lot of things for the trip, but Ewen is the project manager and responsible for the program. I want to make clear that we made a trip in the beginning for healthcare politicians and decision makers in Swedish healthcare. But quite soon we knew that there were interests from companies. So the program you will find on Piku's webpage is quite detailed, but we will still add events, networks, business-related meetings, and such things for companies that join, and together with SweCare, of course. So you will have a great complementary program as well. And I also think that all the questions that have been raised today will definitely be very good answered at the study trip, since we are meeting representatives from department, hospitals, clinics, and we are having the time for deepened questions and answers in discussions and meetings. So you will be fully informed about those things that you are really interested in. Yeah, and like Mr. Gu and also Koka Lu said, the things that Taiwan is very good at when it comes to healthcare is something we can really learn from in Sweden. Our healthcare system is more than 100 years old and therefore also quite inefficient, although we have a good healthcare, but the system is not so good. So we need to learn about that. Do you have any questions about the study trip? We're happy to try to answer your questions. Me, anyone?
I just had a question about the price, because it includes in the flight from Sweden, but in case someone wants to join from another country, how is that then?
That will be arranged. We go from Arlanda in Sweden and we go from Kastrup, since that is preferable for us in southern Sweden. But if someone wants to join from somewhere else, just let us know. We will, of course, book the travelings, the planes, the flights in good time. So we need to know that quite in good time, but it will be no problem.
And is there a registration deadline?
I think 2 months before is needed, both for getting the flights and also to prepare our friends in Taiwan for the guest lists and hotels and everything. So that would be mid-August.
Okay.
Yeah.
Good. Hey, I think that was quite informative, and it sounds like an interesting trip, and we're happy to be supporting you in this. If there are no other specific questions, I'd like to thank you so much, and thanks to Koka once again, and of course to the Taipei mission. Yeah, okay. Yeah, Ingrid?
Yeah, I just want to add that I said you can find our program on the webpage, piku.se, and we can also send you more details, and if you want anything from us more, just let us know.
Yeah, thank you. And same, you can also contact me if you like some additional information, even though Ewen is the expert on the trip, of course.
Sure.
Yeah. Okay, but thank you so much, and happy to have had
Thank
you
you
with
all.
us.
Thank you.
Thank